More than 2,300 new coronavirus cases were reported in our county today. 10% of the tests taken were positive. That pushes our total now to more than 132,000 total cases since the start of this pandemic, and 28 more deaths also reported today. Right now, nearly 1,400 people are hospitalized, and Southern California's ICU capacity remains at 0%. San Diego County Supervisor Nathan Fletcher joins us now with some thoughts on what we're seeing. Supervisor Fletcher, what do you make of the new numbers as you hear them here in San Diego? Our cases are going up, hospitalization opportunities as far as capacity is going down.
Well, in the spring, Andrew, we faced a brush fire, and we came together, put in place measures, and we were able to knock it back. What we're facing now is a full-blown raging wildfire of COVID-19, and it's going to take us longer, and it's going to be harder. And what we're seeing head into the holidays ought to be a stark reminder to all of us. Times are difficult, times are hard, people are fatigued, but we've got to come together. We got to knock this thing back one more time. And so much of what we see today, Andrew, is coming directly out of Thanksgiving. And that is why, as people make plans for just a few days from now, we're not giving up every holiday, we're not giving up every Christmas, but we enjoy the holidays because we love our families and we enjoy our time with them. And because of that, we've got to limit those gatherings this year, just this one, so that they can be around in the years to come.
Okay, so given these new numbers, regardless of what happens, obviously, in the weeks to come after Christmas, the hospitalization rates are super high and the ICU bed capacity is extremely low. We just had a report 45 ICU beds are available in the county. What do we do at that point? You and I kind of talked about it last week, but we get to zero, then what?
Well, we're going to do everything we can to fight. I mean, look, we've stockpiled ventilators, which hospitals are now calling on ventilators. We stockpiled back in the spring. We're doing everything we can to ramp up and get some emergency help in, try to increase some beds, try to get some more staffing. So we're pushing the federal government, the state government. We're looking around California, around the nation, around the world to find anything we can do to increase our capacity. But you're right. The situation for our hospitals is not good right now, and they're canceling procedures and they're diverting patients to try and free up space. But it is likely to get worse because of that delay. And so when we're going into the first week of January, it is going to be a monumental task to try and maintain the integrity of our healthcare system. And we're working day and night to try and bring on new services, streamline things. Our hospitals are really shouldering the bulk of this, and they're doing incredible work. But it is very concerning about what the hospital situation will look like the second week of January in particular, which is a reminder we just got to slow this spread.
Yeah, you have this convergence of all these things coming together, the results of Thanksgiving, you have the Christmas holiday coming up, and then you have the vaccine. So where are we when it comes to vaccines and distribution with that?
Well, I mean, we're doing well. And, you know, we got the first dose of first batch of Pfizer vaccines, and we just got another batch of Moderna vaccines. Those are going, again, we're working through this in phases and tiers. Right now, those are going to healthcare workers that are the highest risk healthcare workers, folks in hospitals, folks that are dealing with COVID patients on the front line. But, you know, we got to keep in mind, we got 3.4 million people in the county, and you know, we've received just, you know, not even 100,000 doses of the vaccine. So it's encouraging, and we should take comfort knowing that hope is here, but it's going to take us a little bit, and the vaccine is not going to get us out of the situation we face today, which is why we should be motivated to take action because of the situation we face, but also taking a little comfort in that we know it's not going to last forever.
So what do you do from your position and from your colleagues' position other than just pleading with people? I mean, you've looked at the situation for so many months now. You've been on the side of more closures. Jim Desmond, for example, has been on the side of fewer closures. You can understand both sides of the argument, but then you have this roller coaster ride that happened last week. Local restaurant owners hear this judge's decision that allows them to reopen, and then they have to close again. I mean, it's so hard for these small business owners. What do you have to say to them, and what can you guys do from a leadership standpoint to try to stop this thing while also not stopping everybody's ability to survive business-wise as well?
Well, look, businesses are struggling, and it's tough. You know, I mean, one of the things in America, we have divided government. We have different branches of government. The judicial branch weighs in. That is the system of our democracy, and it's really unfortunate in its impact, where one court can rule that the public health orders are not valid, and then literally a day or 2 days later, another court can say, no, that's not the case. And it is frustrating. I mean, look, I wish we had unanimous agreement. You know, the best way to deal with this is limiting the high risk settings, but then being there to provide economic help and assistance and relief. And it is very challenging. I mean, folks can have different perspectives, but not different facts. And, folks are going out there and advocating that people defy the public health orders and spreading misinformation about COVID. And these are elected officials, and they bear a part of the responsibility for the increase in cases, increase in hospitalizations, and increase in death. And I think from the beginning, Andrew, whether your primary focus is economic and you care most about businesses, or your primary focus is saving lives and you care most about the vulnerable, we do the same thing, and that's slow the spread. And I would point out, all the folks that are on the open everything, defy the orders, they've never had a single suggestion or idea to change the trajectory and slow the spread. The only way to do that is the difficult and hard measures and steps we're advocating in the public health orders. We've made millions of dollars available. The federal government is coming in with assistance. I know people just want to work, but we got to get through this so that we're in a position to work. And so it's just really continuing to plead with the public, please follow the guidelines, follow the adherence, trust your public health experts, trust your medical doctors, and know that we will get out of this, but we can't avoid dealing with the reality we face.
Once again, we all have to work together, certainly, especially at a time like this. Supervisor Fletcher, thank you very much for your time from the road and for your insight as well tonight. Thank you.
Thank you, Andrew.